Hello, I'm Dr. Lawrence, and I'd like to thank you for ordering this DVD regarding vertigo, dizziness, and balance disorders. When one thinks of vertigo or dizziness or balance disorders, most likely they associate that with a problem with the inner ear due to something called BPPV, or benign paroxysmal positional vertigo. What I'd like to tell you today and explain to you is that the issue with respect to balance and dizziness and vertiginous disorders goes well beyond just the inner ear. In fact, this information I'm almost sure that you've never heard before. So just to take a quick step backwards, I'd like to explain what are all the systems that are involved with respect to balance in the human body. And of course, these systems include the brain, the cortex, the visual system, the eyes, the cerebellum, the inner ear, as well as the joint position and proprioceptive system in the human spine. It's important to understand that when one looks at these kind of systems, you want to make sure that all of these particular systems are working in a proper integrated fashion. In fact, the most common treatment for inner ear problem due to this BPPV is a maneuver called the Epley's maneuver, which attempts to reposition these little granules in the inner ear in order to restore balance. But what's important to understand is that whenever one of these systems, and for example the inner ear, goes out of sync, these other systems have to compensate. And it's important to understand that if one doesn't take into consideration these other systems, once the rehabilitation is done, the effect of the treatment can be limited at best. So when we look at these sort of things here, we will evaluate all these systems to make sure everything's firing in a proper order. So when we do the further evaluation of these problems, we also look at it from a metabolic standpoint. And this is very, very important because the metabolic involvement can have an effect on one or several of these particular systems. For example, our metabolic evaluation will include a full blood workup. For example, we will look for things that are inflammatory markers, for example, that can have an effect on the nervous system that will in fact influence this particular type of problem. Another main important thing is food sensitivities. It's often overlooked that there are certain foods that individuals can ingest that may be causing a slow problem with some of these structures, for example, the cerebellum, that over time they may have noticed that their balance is getting progressively worse over time. And these maneuvers like Epley's, for example, have been proven to be fruitless. Other things we look at is what's known as an ASI test, or adrenal stress index test. Again, this test helps us to evaluate factors that will influence the blood sugar regulation. And of course, nerves need glucose, oxygen, and proper stimulation to function properly. This is a very important test for that. Again, this test can also show us things that relate to, does an individual have changes in their blood pressure when they change position, for example, from lying down to sitting up, or they may be losing their balance temporarily. Again, this test is very important to help us give us some insight into that. With respect to the treatments for this particular type of problem, we will use painless treatments that will, from a neurological standpoint, be involved with the visual system. We maybe use a particular type of visual stimulation to help restore the balance. We can be using things like eye lights, which are particular light flashing in particular quadrants of the eyes to help restore a particular type of balance disorders. We may use calorics, which is warm water squirted into the ear. We may use things like sound therapy and other things that help to neurologically restore the firing of these systems back in sync. With respect to the metabolic approach, we will use specific supplementation to help restore any type of imbalances with respect to due to our laboratory findings, and we may also require an individual to have some diet and lifestyle recommendations. In my experience dealing with these particular problems, the two most common areas that are involved with balance disorders and vertigo and dizziness, for example, stem from the brain and the cerebellum. I fully can see and understand each time I treat individuals like this is a very, very debilitating problem. So it's my sincere hope that we can help you, and we sincerely look forward to working with you in the future. Thank you.